Aortic stenosis is a deadly disease, and it really needs to be dealt with in an expeditious manner. We've seen many patients in our clinic where that patient has been delayed in their treatment algorithm. That becomes somewhat difficult to manage because at times the heart function becomes so prohibitively low that the options become very slim. One of my most disappointing visits in the clinic, and we do have a very functional heart valve team where the surgeons and the cardiologists see the patients together. And as we sit there with a patient who we know has had severe valvular disease for a year or two, and now are at a point where they have no options, where their heart ejection fraction is so low that there becomes a pathway that they will most likely die, really becomes disheartening to us. We believe that the referring physician, the sooner they send that patient to a comprehensive valve center, that may facilitate the care of these patients and to minimize further heart failure and complications that occur associated with that. So we're referring directly to a valve team as soon as the patient has severe aortic stenosis, whether they're symptomatic or not, allows them to get plugged into this valve system. And sometimes watchful waiting is the right therapy, and sometimes moving forward with the therapy becomes important. But the most important aspect for the referring is to be able to send that patient as soon as they have valve disease that's noticed on echocardiograph.